Greetings from Sembach. I want to take a few minutes to give you an update on our continuing efforts to help you stay safe and healthy during your tour here in Europe. We're doing our best to keep you informed about our COVID vaccination efforts at our Army medical treatment facilities across theater. As you know, we have started vaccinating the military community through a phased distribution process that prioritizes those most at risk of contracting COVID-19 and those who are most vulnerable. So far, we have focused on vaccinating healthcare workers and first responders and our deployable forces here in Europe. We have also started to vaccinate other mission essential personnel, including our teachers and food service workers. Just last week, we also started to focus on some of our high-risk beneficiaries as determined by medical staff and in accordance with DoD and CDC guidelines. As we receive more vaccine shipments and work our way through those population groups, we will be able to focus on our healthy service members, civilians, families, retirees, etc. Please stay tuned to your clinic's social media and web channels for the latest information on where we are in the phased distribution process and when it's your turn to be vaccinated. Please keep in mind, distribution will vary from one clinic to another based on a number of factors like how much vaccine that clinic received, how many people in each population group, etc. Some of you might be wondering if you fit into the high-risk category. Our medical staff is currently working to identify high-risk patients and place them in priority groups. They are looking at medical history, CDC guidance, and the DoD population schema to determine who should receive the next doses. We are also beginning to offer second doses to those of you who have already received your first COVID vaccine. Please remember that your second dose should be administered no earlier than 28 days after receiving the first one. You should follow the instructions on how to schedule a second dose appointment given to you by your MTF when you received your first vaccination. If you were instructed to call the appointment booking line after 14 days, we urge you to make that call and get scheduled for your second dose. Remember, the vaccine is 94% effective only after receiving 2 doses. I strongly believe that this vaccine is extremely safe and effective, and while it is absolutely voluntary, I encourage you to make an informed decision to protect yourself, your family, your fellow soldiers, and your community. Finally, we ask for your continued patience with our staff who are doing their best to vaccinate the community as quickly as we can while doing so safely. We appreciate your understanding and your interest in joining the fight to move past this pandemic. Army Medicine, Army Strong.